Figures shared exclusively with ITV News show mental health patients are facing disproportionate delays in A&E. 1 in 4 wait at least 12 hours for emergency care. That's more than twice England's average rate. And one woman told us it was 3.5 days before she received treatment. Hardly conducive, she says, to getting better. Well, here's our health correspondent, Rebecca Barry.
The sounds and sights of a busy A&E department. Stressful, especially if you're in a mental health crisis. It's 10 a.m. at the Royal Berkshire Hospital. 3 patients here are suffering mental health emergencies. One of them's been here 40 hours. Across England, a shortage of beds in psychiatric hospitals means patients are left for days deteriorating.
We have patients here 5-6 days waiting for mental health beds. I think they deteriorate within that time, which means sometimes their behaviour escalates. We see a lot more violence and aggression towards the staff. You go away thinking you haven't done the best job possible, and you feel that you've let them down.
Being in A&E in a mental health crisis is really daunting. It's distressing.
Emma has schizoaffective disorder.
The longest I've been in A&E in a mental health crisis was 87 hours, which was about 3.5 days.
And what was that experience like for you and for your mental health?
It certainly made things worse. I found it really difficult being in there. It took 11 hours before I was given a gurney, a kind of trolley to lie on, and would be just lying on the floor in the waiting room.
Figures obtained by the Royal College of Emergency Medicine and shared exclusively with ITV News reveal last year 1 in 4 patients with a mental health diagnosis waited 12 hours to get a hospital bed, compared to 1 in 10 of all patients. And while the likelihood of long waits for patients overall went down slightly, for mental health patients they increased to a record high of 23%.
In the last month we've had 250 people that have come through the unit.
Here in Lincoln they have an alternative to A&E, a mental health urgent assessment centre, calmer, quieter, with specialists to assess and treat.
They help support me and make me better every time.
Amy lives with PTSD and psychosis. For her, this service has been life-changing.
I'm now me. Go out, start earning money, and just become more self-sufficient.
But there are only around a dozen of these centres across England. That's out of 170 A&E departments.
Will you apologise to Emma, who told us that her 3.5 day wait in A&E was hugely traumatic?
Of course, because nobody wants Emma or indeed any other person to be waiting that long in A&E. We all want...
So do you apologise for government failings?
Well, of course we apologise to Emma and everyone who waits for longer than we would want in A&E.
The government told us it's increased mental health funding and is investing in alternatives to A&E. But at the moment, some feel the most vulnerable are being let down. Rebecca Barry, ITV News.